Coming up on Tuesday, February 28th, an event at Crossing River South called Live Smart for Your Heart. Again, it's on Tuesday, February 28th from 5:30 until 7:30. And we're talking today with Tammy Thompson, Cardiac Rehab Director. And there's a number of different presenters at this, a lot of good information about living smart for your heart. So first of all, we'll say hello to you. Tell us, first of all, just briefly, and we've talked with you on the radio before, talk about your role as Cardiac Rehab Director here at Crossing River South.
Well, by profession, I am a clinical exercise physiologist, so my focus is on patients coming out of a current heart event, heart attack or bypass surgery to fix their heart, and we take them through a course of exercise sessions and education sessions to learn how to change lifestyle behaviors so that they don't wind up with a second heart attack down the road.
Yeah, and I think what you're kind of getting at is that it isn't always about, well, here's some drugs, here's a prescription for you, and we'll cover things up. Really, if you want to take control of your health, it's doing just that. It's finding ways to implement exercise and a healthier diet to help prevent that from being a problem, at least for a while.
Yeah, so exercise is medicine, and we tend to really tell our patients that you are using exercise as medicine to fix your heart and help you live longer in your life. And along with that, nutrition, lifestyle changes such as regular exercise and making sure that they're following a low sodium diet and a diet that's balanced with fruits and vegetables is kind of our focus.
And really, as you get to know that patient and their situation, their needs, their lifestyle, up to that point, it isn't a one-size-fits-all method to create that path toward a healthier heart.
Correct. Every patient has a treatment plan, and the treatment plan is designed around what the patient wants to, what they see as the most important piece to change in their life. We don't try to make them change a whole bunch of behaviors all at once because it can be discouraging during the process. If we don't want anyone to feel like they're failing. So we set short-term goals, something that's important to them. We look at stress management. Sometimes that's a piece that people really need to work on when they're entering cardiac rehab. But we really try to encourage exercise as being the basis of helping with all of the lifestyle intervention that they need.
Yeah, it seems like exercise is a great way to start because it seems like exercise or getting into a good exercise routine at whatever level kind of naturally leads to some better eating habits, kind of naturally leads to reduction of stress.
Mm-hmm. Yeah, exercise makes you feel better right away. Many of our patients see just slight differences in how they feel within just a week of doing some exercise, and then just feeling better alone makes them want to focus on other areas such as quitting smoking or changing the diet, wanting to be healthier.
And you'll have a number of experts there that are there to talk with people that show up to present about different ways and different ways in which people can take control of their health, their heart health.
Yeah, Dr. Vincent, our Crossing Rivers Health Clinic physician, is going to focus on how our lifestyle impacts us long term, how it impacts our bodies from, we call it metabolic syndrome, and it's made up of a focus on cholesterol management, weight management, and exercise, and how that all affects, if we don't exercise, we don't watch what we eat, and we have high cholesterol, we have high blood pressure, then he's going to kind of take a time to talk about what that actually does to our bodies and how all of those pieces kind of fall all together.
I know you'll also be talking about some other things when it comes to simple tips for eating out or navigating the grocery store, or I think a lot of people think eating healthier is going to be way too expensive, you can't afford that. We'll be touching on those topics as well.
Yes, so our other exercise physiologists here at Crossing Rivers Health, Patrick Stovey and Austin Nice, are going to be speaking to just kind of helping people understand that eating healthy can be very affordable. they can help them understand how to read a food label to really see the amount of sodium that's in a product, and kind of give them tips on alternatives to, rather than this choice, other choices that might be a little bit better for them.
Yeah.
So.
And you don't need that first heart attack or heart episode to start making changes in your life, because you want to prevent those things from happening.
Right. Actually, the healthcare industry is very much shifting its focus on preventative, and keeping people from having that first heart attack, making our communities aware of the impact that exercise, eating right, has on our health, and then over the long term, decreasing healthcare expenses nationwide.
And improve their quality of life overall. Again, the event is coming up on Tuesday, February 28th. It's Live Smart for Your Heart from 5:30 until 7:30. As she mentioned, all of the presenters that would be there. Question and answer session will be part of this too. So if you have your own specific individual questions, you can talk to some of these experts and get some good advice, I would think.
Yes. Our evening is going to start right at 5:30, and we'll be serving a light meal from 5:30 to 6. Dr. Vincent will be talking from 6 to 6:30, and then Patrick and Austin will be talking from 6:30 to 7, and then our question and answers.
Yep, and reservations preferred. You can register online at crossingrivers.org/livesmart, or by calling 608-357-2349. Tammy, anything else to add before we let you go?
No, we're really looking forward to having a big crowd and hoping that everyone in the community will take advantage of what we have to share.
All right. We've been speaking with Tammy Thompson, Cardiac Rehab Director at Crossing Rivers Health. Again, the event, Live Smart for Your Heart, on Tuesday, February 28th.